In mid-2016, I had almost graduated as a dietitian, and I was working my retail job one Friday afternoon when a family came in. The young girl, maybe 9 years old, was affected by obesity, as were her parents. I served them. The girl was very happy. She had secured a new pair of shoes. But as I was serving them, I couldn't help but think, were these parents aware of their child's risk for early diabetes, cardiovascular disease, mental health struggles, early death? That 41 million children in the world live with these risks because of their weight. How could I help this family, this child, and children like her in the future? After they had left, I thought, can we try and use risk positively? Can we calculate risk for childhood obesity, communicate this to parents from the youngest possible age and work with them to prevent? Could we predict to prevent? I was so struck, so inspired, that what you see here is the piece of receipt roll on which I wrote the initial idea that Friday afternoon. 3 years later, I have developed iPathway, a simple digital tool that can be used by health professionals around Australia to accurately predict childhood obesity at age 9 from 12 months old. To develop iPathway, I accessed a database of 2,000 Australian children to find the strongest predictors of childhood obesity. I tested 14 predictors and found that we only needed 6 of these to predict childhood obesity with a 75% accuracy. And by international standards, this accuracy means iPathway is acceptable for clinical use by health professionals. All health professionals have to do for a baby at 12 months old is collect mother's height and weight, find out if the mother smoked during her pregnancy, how much weight the baby gained in their first year, what their sleep patterns were like, if they were born prematurely, and consider their sex as male or female to predict and potentially prevent childhood obesity. And most of these predictors are already collected in normal practice. But obesity can be a sensitive topic, and that's why I've interviewed more than 40 health professionals and parents, and iPathway has been extremely well received. Their thoughts and ideas will help to make iPathway as positive and non-judgmental as possible. And now, in partnership with Children's Health Queensland, we are building a pathway of prevention strategies for health professionals to use with infants identified as high risk. We are then making sure iPathway becomes routine at the 12-month health check, delivered by your local nurses and GPs. Of the 300,000 children born in Australia every year, 70,000 will develop childhood obesity. iPathway can be their pathway to a healthier life. Thank you.